Well, thank you very much for inviting me to participate in this panel. One of my appointed tasks as the first speaker up on the panel was to bring everybody in the room up to sort of a common vocabulary, hash this, blogging that. And so to do that, I'm going to actually show you a video which is far more entertaining than I am, and it sort of captures the current state of art of social media. Okay, that video, as you see, is available on YouTube, and I should note that it was recently updated. There was an incorrect piece of information in the original video that said that Wikipedia was more accurate than the Encyclopedia Britannica, and that was quickly corrected by community responses. The study actually that was done showed that it was equally accurate, not more accurate than Encyclopedia Britannica. So again, it shows you how communities are self-correcting. So let's just go back for those of you who are sitting way back in your chairs after watching that, maybe feeling a little bit out of connection. Let's go back to a definition. We'll start with Web 2.0, which was a phrase coined by O'Reilly Media in 2004, and it refers to second-generation web-based services, such as social networking sites, wikis like Wikipedia, or communication tools, folksonomies, where people can organize and tag information and organize them into either subjects or into communities. The emphasis is on online collaboration and sharing among users. And of course, I will give a source of Wikipedia for that definition. So if you look at the characteristics of Web 2.0 and of social media, they involve tools in all of the applications that encourage user-generated or user-driven information sharing platforms. And the rubric or the rhetoric surrounding this is that these platforms are broadly democratic. They're collaborative and they're interactive. They allow for rapid and low-cost dissemination of experiences, opinion, and information. They also allow for repurposing or mashing up of information. I think a lot of people, when we talk about social media, thinking about the cat playing the piano on YouTube. As I'll discuss in my own research, often social media is actually taking information from authoritative sites or mainstream media, annotating it, and repurposing it, commentating on it, ranking it and rating it. And so repurposing it for their own uses or mashing it up. So I want to ask a question of this audience, just so I can gauge where you're all at. How plugged in are you? What kind of social media do you use? Well, let's go to the next slide, because that'll give us at least some relative data. Can you go to the next slide? What social media do you use every day? 34% are using Facebook every day. That's to be expected. I'm surprised about 8% on YouTube. So very few people watching immunization videos on YouTube. I'll talk about that in a moment. Okay, I'll go back to my next slide. And if you look around the demographics, it's not as surprising. Do you include social media in your health communication or strategies or campaigns in whatever capacity that you're working in? Yes, no, or plans in the future? So should we take this seriously? I realize I hope I answered the so what question, but we know that Web 2.0 or social media cater to the millennial generation that's born between 1981 and 1993. We didn't have an option for everyone to vote on how many of you fall into that demographic. It's the largest US generation since the boomers, and the demographics are similar in Canada. 38% of this generation are non-white. They're wired and collaborative, and we expect, certainly myself as a researcher, I'm interested in how behaviors of this generation are going to influence public deliberation, civic engagement, and how we can have conversations with people about health. In terms of public deliberation, a sort of preview of the future occurred during the most recent US federal election, where the Obama campaign used an enormous a range of innovative social media tools in order to create grassroots support for their campaign. And in terms of having this taken seriously, people sort of take note that the campaign website interestingly enough, when you go back to that definition of social media, the idea of usability, user participation, these are the tools that actually draw and define social media, but they're precisely the antithesis of the kind of authoritative structures of scientific communication, science, peer review, and government communications. So it's rare for governments to be able to embrace the interactivity and the uncertainty that comes with relinquishing control over the information. This is completely an example of this, but the Obama campaign website allowed individuals to tailor their own experience and interaction with the campaign website in a myriad of ways. So they could actually see local events, they could contribute locally to a blog, they could post videos, so they could actually influence the online campaign content. Obama has emerged as a powerful presence on social networking sites. Suffice to say, he has a lot of fans and a lot of followers and friends in the various websites. One of his YouTube videos, Yes We Can I just see a show of hands of anyone who's familiar with the Yes We Can campaign? Yeah, see, it went really viral. This quote here is from Michael Geist talking about 12 million times, or 2 million, or over 1 million times in 2 days. It's many multiples of that at this point. And not only did the Yes We Can video inspire grassroots activism supporting the Obama campaign, bringing what was once a really non-entity in the Democratic nomination process and then in the actual election into a front-runner, but it also spurred interesting social commentary and critiques. And this is very classic of social media response. The Obama put the Yes We Can out, and then of course the Republican response was, no you can't, or yes we can, with all of these Christ apocryphal symbols around him mocking and making fun. And so the yes we can as a campaign message actually varied very much on the context with which it was being viewed in the different social media platforms. So yes we can be seen very ironically, or it could be something that's really inspiring and uplifting. So it's really important that the message that you put out is going to get repurposed, and you can't be afraid of that if you're going to use social media platforms. So as a researcher, I should say myself and I've started a small social media research group here at the University of Toronto in collaboration with a colleague of mine at the University of Ottawa, Keelan Wilson. We are both interested primarily in immunization discourse, for those of you who have an interest in that as well. We became interested in social media because vaccine critics were using social media. And I'll talk a little bit about that later. And they were certainly using it, we felt we needed to study this phenomenon. So as a researcher, I'm engaged in several pilot research projects trying to understand the utility, the usability, be a bit of an anthropologist and study how people actually use these platforms and how they share health information. So there's a lot of promise and there's a lot of hype about using social media for public health knowledge exchange. We know that with more democratic participation in social media, there's going to be a wide range of quality and content. The most popular sites, similar to search engine searching, may not be the most useful. There's also ethical concerns about an educated, informed public there's an expectation that there's a devolution of responsibility and power from experts to the public. Concerns about pitting peer review and scientific authority against the knowledge and the wisdom of the masses. And finally, that the amount of information and the tools for searching for information, the game has really changed. And so we need sort of new guidelines for how to seek out health information online. But the presumed utility, the promise, is what kind of gets me up every day to go and do research in this area. The utility to help and assist patients or consumers for seeking out good quality health information. The experiential components of some of these medium are very exciting. I'm doing several pilot projects in virtual worlds and with virtual gaming so that people can actually experience symptoms of certain diseases, they can practice abstinent behavior, or they can see the effects of not practicing that behavior. They can, as I'll show you in a moment, they can experience symptoms of AIDS on an avatar, or they can, in social situations, experience what it's like to practice safe sex. Consumers can form their own path for information, seeking out the information that they want in the manner in which they wish to receive it. And I think that that's the critical element of social media and knowledge exchange related to
public health information.